Hello and welcome to Diabetes Connections in the News. I'm Stacey Sims, and these are the top diabetes stories and headlines of the past 7 days. As I do every week, I'm going to link up my sources in the Facebook comments where we are live and in the show notes at diabetes-connections.com when this airs as a podcast, so you can read more if you want, whenever you want. In the News is brought to you by Real Good Foods. Find them in your local grocery store, Target, or Costco. Real foods, real food you feel good about eating. Our top story this week: a discrimination complaint against the Colorado High School Activities Association has been filed with the U.S. Department of Justice. At issue, a student was disqualified for wearing his continuous glucose monitor. Ethan Orr is a 16-year-old swimmer whose team qualified for the state championships. According to his attorney, Orr wore a blood glucose monitor taped to his arm during 7 prior matches, including the one in which his team qualified for the state champs, no issue. But at this meet, the ref said Orr would not be allowed to swim in his last race because of his glucose monitor and tape. They didn't have a sub, so the whole team was disqualified. The attorney says this is simply blatant discrimination against a kid with a disability, and it led to an unnecessary and unfair consequence to his team, himself, and the school. According to the lawsuit, Orr is protected under 2 federal laws, the Americans with Disabilities Act and Section 504 of the Rehabilitation Act of 1973. I have reached out to the local reporter on this story, and I hope to talk to the family soon. People with type 2 diabetes should be considered in remission after sustaining normal blood glucose levels for 3 months or more without medication. That's a new consensus statement from the American Diabetes Association and several other international groups. They recommend testing every year to determine long term maintenance. The real news here, as I see it, is trying to get people to stop saying reversal or cure when it comes to diabetes. The statement here doesn't seem to be about the science, but says the word remission strikes an appropriate balance between the diabetes not being active and progressive, but also recognizing improvement may not be permanent. Got a lot of comments and questions about some changes noticed on the Dexcom G6 app recently. It turns out Dexcom has removed what's called data smoothing from its most recent update. As of August 9th, they say, and take a look at this, the Dexcom G6 app used to smooth all but your current readings on your trend graph. With data smoothing, there can be some differences between the G6 reading you see in real time, the white circle, and the G6 readings you see in the past on your graph, black dots. I am showing a photo here, and I will post this with the podcast episode for those listening. To avoid these differences, Dexcom says, we removed data smoothing from the Dexcom G6 app in the 1.9 release, but the Follow app and receiver continue to smooth past CGM data. We will remove smoothing in an upcoming Follow app release to match the G6 app, but we don't plan to remove data smoothing from the receiver. These differences don't affect the real-time glucose data alarm or alerts, and honestly, I am not sure why they're doing this or why they smoothed in the first place, but we will follow up and try to find out more. Not a lot of answers here, but this one is interesting. Apparently, people with type 2 diabetes are unlikely to develop migraines, and people who get regular migraines are less likely to develop diabetes. To find out why, scientists are looking at 2 small proteins that are linked to migraine and drive production of insulin. This team from the University of Tennessee says some of the newer treatments for migraines could increase the risk of diabetes because of the use of these proteins, and they want to figure out how to prevent that. T1 International is out with the results of their 2020 Global Out of Pocket Cost Survey for people with type 1 diabetes. Worldwide, 1 out of every 4 respondents reported having underused their insulin at least once within the last year due to high cost. 63% of participants reported disruption of insulin supplies, and 25% reported an increase in insulin pricing related to the COVID-19 pandemic. They've conducted this survey every 2 years since 2016, adding additional questions each year. This time, the results were published as a research paper in the Journal of Diabetes Research and Clinical Practice, and that is linked in the show notes. More to come, including news about a rare form of diabetes. But first, I want to tell you more about one of our great sponsors who helps make Diabetes Connections possible, and that is Real Good Foods, where the mission is be real good. good. They make nutritious foods, grain-free, high in protein, never added sugar, and from real ingredients. I told you I was in Target last week. I saw their new entree bowls and I tried the lemon chicken, which was great. I also bought the lasagna, which was really good. They just keep adding to the menu line. If I sound surprised there, it's because my husband he owned an Italian restaurant for many years. So, we're a little picky, but the lasagna was good. And you can buy online or find a store near you with their locator right on the website. I will put a link at the Facebook comments and, as always, as diabetes-connections.com. Back to the news right now. And this is from the UK, but I think it's an important reminder that there are more than two types of diabetes. It's a new plan to discover and treat monogenetic diabetes that's caused by a single gene mutation, although the specific gene affected can differ. The condition occurs in two types: neonatal, which can occur within the first 6 months of life, and MODY, that develops later, often before the age of 25. Overall, about 2% of all diabetes cases are thought to be monogenetic. The National Health System in England is forming a new training and treatment program to make sure these patients receive the correct treatment sooner. And finally, thousands of people in the path of Hurricane Ida are still without power, possibly need help getting their medication. I want to make you aware of the Diabetes Disaster Response Coalition. This is a group of lots of diabetes groups put together. If you need immediate help or want to plan for an emergency, they have the resources. Physicians and healthcare providers can call 1-314 insulin to report these supply shortages and request support. If you have diabetes or you love someone who does, you can call 1-800-DIABETES, and that will give you more information. Both of those numbers will be linked up here again here on Facebook and in the show notes. And that is it. Please join me wherever you get your podcasts for our next episode. Tuesday, we're talking to the folks from Walmart about their deal with Novo to sell their own brand of Novolog insulin. And the episode out right now is with Mankind, makers of Afrezza inhalable insulin. Please join me again in just a couple of days. And if you like In the News, be sure to share it. Thank you so much. I'm Stacey Sims. I'll see you back here soon.